tuned in to the Andrew Lawton Show.
Let's take a moment here. This is a story that's closer to home for me. I live in southwestern Ontario, as many of you well know. And the reality is, in the city of London, we used to just be this nice little quiet, sleepy city. It was more conservative culturally, not necessarily politically. And I remember even a decade ago looking at the drug situation in Vancouver and seeing that as a problem over there. And London very quickly became, around that time, 2015, 2016, one of the worst cities in terms of a drug problem. London was one of the cities that early on embraced, needle distribution, crack pipe distribution, all of these other things. And all of that is novel and quaint compared to what we're seeing now with the proliferation of so-called safe supply. Now, this has been an issue we've talked about at a relatively length. Well, we've talked about it at length. I had Dr. Sharon Koivu on the program a couple of weeks back, and she is an addiction medicine physician in London, but she used to be a significant champion of so-called safe supply, and she did what any other scientist and researcher does. She followed the data. And the data showed her that these things were not only not helping people with drug addiction, but they were making things worse. She saw another number of key metrics continue to rise and, in fact, balloon. Well, now we have another report from our friend Adam Zivo, who is with the National Post and also is the founder of the Center for Responsible Drug Policies. The police seizure of hydromorphone pills skyrocketed 3,000% after the city's safe supply or so-called safe supply expansion going back to the year 2020. This is massive, a 3,000% increase. Given that this was finding these hydromorphone tablets were finding themselves being diverted to the black market. Police were seeing this, didn't really say boo about it, didn't speak up, didn't take aim at any of these policies in any public way. And in fact, Adam Zivo, as he's recounted in his article here, he had a heck of a time getting some of the information that was necessary from police and getting this disclosure. And there was a former London police sergeant who has now become a documentary filmmaker that was trying to do similar stuff. He was trying to do research on this and was finding himself getting absolutely stonewalled. But in early June, the deputy chief of the London Police Service, Paul Bastian, confirmed to Adam Zivo that hydromorphone seizures have gone up. Just to put some raw numbers on here, in 2019, the London Police had fewer than 1,000 tablets seized. In 2020, that number had increased sharply. And when you get to 2022, over 30,000. And they're expecting this year it will match or exceed last year. So we have seen a massive, massive increase in this. This is just one drug in one city in Canada. But I think there's probably a bigger picture here that we'll see. Adam Zivo joins us on the show again. Let's just talk about this here, because diversion is something that there is irrefutable evidence it's happening. You've pointed to like ads on Reddit threads promoting diverted drugs. We've seen these numbers, yet still the activists and advocates of safe supply, in some ways pretend it's non-existent at all, or when they are confronted with the evidence, just downplay it considerably. But this is not an insignificant increase.
No, going from 1,000 pill seized in 2019 to 30,000 pill seized in 2023 is huge. Most people, when they hear these numbers, they don't really have any frame of reference. But we have to remember that just 2 or 3 of these pills is enough to induce an overdose in an opioid-naive user, such as a teenager. So essentially, these 30,000 pills is the equivalent of 10,000 overdoses. And as Dr. Sharon Koivu pointed out when I interviewed her for this piece, these seizures represent just a drop in the bucket of what is flowing throughout the city overall. So we're looking at probably hundreds of thousands, if not millions of pills flowing through London, Ontario because of safer supply.
Let me just ask you about this, because if you look at one drug, you look at hydromorphone, you see an increase. It's not all that surprising that if diversion happens, that when this product is given an expanded access in a particular point in time, that you're going to see an increase of it. My question would be, and I don't know if we have the data on this, is there a net increase in drugs in the city, or has hydromorph just replaced something else that would have been seized had these tablets not been. And in that case, the activists would argue maybe it's healthier because this is better for you than some of these other things.
Well, it's hard to talk about the net number of drugs, net amounts of drugs flowing through a city. That's incredibly hard to track. However, from my understanding, Safer Supply has not replaced the illicit drug supply, but has in fact only subsidized it. The reason why Safer Supply clients sell their drugs in the first place is because hydromorphone, though it may be as powerful as heroin, is only about 2% as powerful as fentanyl. And so for a fentanyl user, hydromorphone, even in large doses, is useless. So they sell their Safer Supply to buy fentanyl. And if all of these Safer Supply clients are purchasing fentanyl and flooding the streets with their hydromorphone, then that indicates the fentanyl market is still very active and that Safer Supply is not replacing it or mitigating it, but rather is subsidizing it. And I think that's very concerning. Now, when we want to look at other metrics that quantify diversion in London, Ontario, so Dr. Koivu did do a chart review of her patients in Victoria Hospital. So she reviewed 200 patient charts between January and June of 2023, and she found that 30% or 33% of the patients who were not enrolled in a Safer Supply program self-reported accessing hydromorphone diverted from Safer Supply. Also, CAMH recently released a report that looked at self-reported drug patterns or drug use amongst Ontario high school students and middle school students. And they do this survey once every 2 years, and they found that between 2021 and 2023, the number of students who self-reported using pharmaceutical opioids for non-medical reasons skyrocketed by about 70%. And the number of students who said that these opioids were easily available also skyrocketed by about 40%. So all of these indicators suggest that there is a huge influx into the supply of pharmaceutical drugs. I mean, prices used to, like these pills used to cost $20 each. Now they sell for about $1 to $2. And that it's not dissuading people from using dangerous substances. It's getting into the hands of kids and hooking them into addiction, which then eventually escalates to fentanyl use and then kills them.
So if a lot of these drug users are offloading hydromorph to buy fentanyl, who's the market for hydromorph? If a lot of these drug users are getting rid of it because it doesn't do what they want it to do.
Well, that's the thing that's so pernicious about this diversion is that the people who buy this hydromorphone tend to be newer users. Let's look at kids as an example. I've interviewed dozens of kids who have told me all about how hydromorphone has become very popular in their schools or in their communities. This is predominantly in BC, and they say that they weren't aware of how dangerous the drug was, right? They know that heroin is bad and that they shouldn't do heroin. And the fact that you often have to inject heroin is a very powerful way to dissuade people from experimenting with it. But when a kid is at a party and someone hands them a pill and they hear hydromorphone and they have no clue what it means, and they're told that it's just a prescription pain medication, which is marketed as safe from the government, they're much more likely to try it. And they don't realize what they're getting into until they're already addicted. Now, that's one group. Other groups include people who are in recovery and who have lower opioid tolerances and who know not to mess with fentanyl and not to mess with heroin, but think that hydromorphone is something that they can handle, once again, because it's marketed as safe. And if the drug is so cheap, how serious could it be? I interviewed an addiction outreach worker in Ottawa who estimated that 90% of Safer Supply clients in that city divert their hydromorphone. And he had friends because he used to be a heroin user. So he had friends and acquaintances who got hooked onto the drug. And a common theme was that they thought it was maybe as potent as a Tylenol 3, which is still an opioid, but it's much weaker because the drug was so cheap. If it was $1 a pill.
So what happened in 2020 that changed this in London so much?
Well, so Safer Supply was first piloted in 2016. It was initially marketed as a way to help stabilize the lives of vulnerable sex workers. Essentially, if we give them the drugs that they want, then they have fewer reasons to sell their bodies on the street to make money to buy drugs. Then it was quickly expanded to become what we know as Safer Supply today. So it was available to anyone really who was severely addicted. And this was a pilot project. And there was a lot of research that suggested on paper that it was doing well. I mean, most of these evaluations and studies were incredibly low quality. Most of them just involved interviewing Safer Supply clients and asking them, do you like this program where you get free opioids? And when they predictably said yes, this was framed as objective evidence of success. So based on these evaluations, Safer Supply was expanded nationally in 2020. The COVID pandemic was used as the impetus for this. Essentially, the argument was that we needed new emergency guidelines to provide these drugs to drug users to encourage them to shelter in place or to prevent them from going into withdrawal or overdosing because they couldn't access their normal drug dealers. And then this emergency situation was very quickly established as Safer Supply as we know today. There was a scope creep, much in the same way how we saw a scope creep in London, Ontario. So that expansion hit all of Canada and allowed many more pilot programs to open up and regular prescribers to provide Safer Supply. So we saw a huge increase in access and consequently a huge increase in diversion.
Are you convinced that London is any sort of outlier here, or that this is something that if you were to get the data in other cities would be pretty much an identical situation?
I would assume that the data is fairly consistent across major cities where Safer Supply is being run. I actually am very interested in reaching out to different police departments and asking them for their data. Hopefully, they'll respond. What I would say is that the data that we have coming out of British Columbia suggests that there is a huge problem there that is as bad as, if not worse, to what we're seeing than in London. So earlier this year, a high-level official from the BC Associations of Police, who was the deputy chief of the Vancouver Police Department, testified in Parliament that approximately half of the hydromorphone that is confiscated in BC or has been confiscated in BC recently can be attributed to Safer Supply. And we have to keep in mind that when you look at the numbers, approximately 5% of the hydromorphone patients in the province are Safer Supply patients. So 5% of these patients account for 50% of the total seizures. So that would require them to divert a truly huge amount of Safer Supply to have such an impact on the market.
I wouldn't say I'm surprised by it, but I'm disappointed that tracking these numbers was not just a given when rolling out and developing these programs, that the governments that approved these, that were pushing these, didn't just want this information up front, that you're having to go to police and hope that they hand it over.
Well, here's the problem, is that Safer Supply advocates and harm reduction researchers often do not want this to be measured. So they make only
I wonder why.
Well, yeah. So they make only the most cursory attempts to measure diversion. Oftentimes, there's studies that measure diversion amount to asking Safer Supply clients, do you divert your drugs? And if so, why? As if you're going to get an honest response from that. Any quantitative studies that exist, which are very scarce to begin with, make no attempt to measure diversion. When the Alberta government pushed for tracing elements to be included into Safer Supply drugs. So, for example, special chemical indicators, special dyes, special colors. The federal government refused, even though this was highly practical, because these kinds of tracers have been used in the United States already to track counterfeit drugs. And in fact, Dr. Andrea Sarita, who is the founder of the original Safer Supply program in London, who is basically the progenitor of Safer Supply and the city's main advocate for Safer Supply, said to parliamentarians earlier this year that she opposes putting in tracing elements because these tracing elements would be stigmatizing, which is, it's absurd. What kind of mental gymnastics do you need to believe that? Like, as if people would somehow feel stigmatized from taking their pink pills on the streets in full public view versus their white pills, let alone the fact that chemical tracers cannot be seen by the public. No one's going to notice the
Worst
fact
case
that
scenario, just like, put it up to your mouth like this if you really need to.
Yeah, it's absurd. And when you have Safer Supply advocates using such absurd arguments to contest the need for tracing elements in Safer Supply, I think that's suspicious. And I think that we also have to keep in mind that many Safer Supply advocates think that diversion is a good thing. Once again, Dr. Andrea Sarita has often defended diversion and has said that, it is better for someone to access diverted safer supply than illicit street drugs. But once again, going back to my earlier comments, it doesn't seem that people are choosing to use safer supply in lieu of illicit street substances. This safer supply is merely adding to the total drug supply and creating a very dangerous gateway into harder substances.
Adam Zivo, great work as always. The piece in the National Post is, as we've been talking about, hydromorphone pills seized in London skyrocket 3,000% after safer supply expansion. Great work, Adam. Thanks for coming on today.
Thanks for having me on the show.
Thanks for listening to The Andrew Lawton Show. Support the program by donating to True North at www.tnc.news.